All right. So if you have read and understood considering a clinical examination station, kindly please begin.
So first I'm going to enter the examination hall. I'm going to wash my hands. Hello, good morning. My name is Dr. Ulfat and my candidate number is 3191. Can I please confirm your name and date of birth?
Yes, Smith, 55 years old.
Nice to meet you, Mr. Smith. Today I have been asked to examine your lower legs. This would include me looking at them, feeling them, and also performing some movements on them. Is that all right with you?
Yes.
All right, so to perform this test, I would need you to please remove your trousers. You could keep your undergarments if that's all right with you.
Okay.
All right, so first I'm going to ask you to please walk for me. Is that okay with you? Do you use any crutches?
No, not normally.
All right, okay, so if you could kindly walk for me. So I'm going to see the gait for the patient. All right, and if there is any abnormalities, any swelling, could you please walk back for me?
Okay.
Okay, so now I'm going to start. I'm going to start looking at your legs. Okay, so first I'm going to kneel down in front of the patient, and then I'm going to start inspection of the both the lower legs. I'm going to first compare. I'm going to see if the skin overlying skin condition, if there is any swelling, if there's any scar marks, if there is any ulcers, any gangrene, any atrophic blanch or lipodermatosclerosis, any venous ulcers. Then I'm going to ask the patient to turn on the sides to see if there is any again scar marks or any swelling. And again, I'll turn the patient towards the back and examine the back. Then I'm going to look for if there is any similarly, I'm going to again look if there is any varicosities, any prominent vessels, any hemosiderin deposition, atrophic blanch, and skin changes. Then I'm going to now, Mr. Thomas, if you could now kindly lie down for me, is that okay?
Okay.
All right then. So now I'm going to feel your legs. Okay. Do you have any pain anywhere?
Yes.
All right. Okay. Could you please tell me which side do you have pain?
Yes, in my legs.
All right. Okay. So I will be as gentle as possible. Okay.
Okay.
All right then. So I'm going to now feel for the femoral junction, which is located 4 centimeter below and lateral to the pubic tubercle. I'm going to now place my finger on the femoral junction and press it. And then I'm going to ask the patient, could you please turn the other side and cuff for me?
Okay.
Okay, and then I'm going to check for any palpable thrill over there. Then I'm going to now start palpating. I'm going to start palpating along the distribution of the great chaffiness, that is along the medial border of the leg to the up to the foot, and check if and constantly look at the patient's face to see if there is any pain, if there is any tenderness around around the area. I'm going to repeat the same along the distribution of the short chaffiness nerve, that is on the lateral border of the legs. Then I'm going to examine the popliteal fossa to see if there is any swelling. Then I'm now going to ask you to perform some movements with me. Is that okay with you?
Yes.
Okay then. So first I'm going to ask the patient, do you have any pain in your hips?
No, not right now.
All right, so now I'm going to take each of the legs upwards one by one. I'm going to take the leg and then I'm going to wait around 2 to 3 minutes for and milk all the blood downstream. And then I'm going to now place my finger on the femoral junction. As I place my finger over this area of your thigh, I want you to slowly stand up for me and slowly sit up on the bed and then stand up for me. Is that okay with you?
Okay.
All right then. So as the patient does according to instruction, I'm going to see if there is any filling up of the veins from above downwards, or if there is no feeling at all. Okay. Then I'm going to all right, Mr. Thomas, if you could kindly lie down back again for me. Okay,
Yes.
now I'm going to do the toniqua test where instead of placing my finger, I'm going to take a toniqua. I'm going to bind it across the femoral junction. Now, Mr. Thomas, if you could kindly again sit up for me with the legs hanging down and then again stand up for me, please.
Okay.
All right. Okay. Now I want. Okay. This is after this. I'm not going to go for the Perth test. So here I'm going to ask the patient with the bound toniqua. I'm going to now. If you could kindly walk for me. Yeah. If you could kindly walk for me, or tiptoe on your on your legs. All right then.
Okay.
Okay, if you could now stand still. Now I'm going to see if there is filling, if there is any engorgement or if there is any filling up of the veins, and I'm going to follow the directions at which it fills up. Now I'm going to, if you could kindly again lie down for me. Okay, I'm going to now take my handheld Doppler, and then I'm going to apply the solution. Then I'm going to run the Doppler stick along the nodes for great Chaffinus vein and along the greater Chaffinus vein, and then I'm going to see at the Chaffino-femoral junction again to see if there is any pathological whoosh sound. Yeah.
Okay.
Okay, there is. Okay, I'm going to repeat the same on the other leg. All right.
Okay.
And now I'm going to complete. So that completes my examination with you, Mr. Thomas. Thank you for your cooperation. You could kindly wear your trousers. Do you need any help?
No, that's all right.
All right, thank you so much. To complete my examination, I would like to examine the complete neurovascular examination of the lower limb, and also I would like to do an examination of the abdomen to exclude if there is any bruit, if there is any aneurysm.
Can you please summarize your examination?
So I have just examined a 55-year-old Mr. Thomas who is presented with bilateral swellings of both the legs, which possibly varicosities. The patient on examination, there were varicosities present on both the legs, right leg more than the left leg. The patient's patients had Trendelenburg test. The Trendelenburg test on the right side was positive, showing incompetence, perforator incompetence, and Perth test and tourniquet test also positive on the right side, but not so on the left side. And Doppler was assessment showed that the patient's right side blood flow was slightly diminished compared to the left side, which was also diminished. And so my conclusion is possibly the patient is suffering.
Yes, provisional and differential diagnosis.
Possibly the patient is suffering from varicosities of both the lower legs, but I would like to keep a differential. Possibly it could be a lymphangiodema. So I would like to even exclude that.
Okay. Any other investigation would you like to carry out?
I would like to do first of all, I would like to do a magnetic resonance venography. I would like to do an ultrasonography of the whole abdomen and a CT scan of the whole abdomen to exclude if there is any aneurysm, and blood test to exclude the other causes such as a complete blood count or to check if there's
any advice you will give to the patient in order to manage patient's condition?
First of all, dietary for a lifestyle modification, cessation of smoking and alcohol, and also also I would like to ask the patient, inquire regarding the occupation of the patient, and possibly modify the occupation and possibly take an occupation where there is less standing and less pressure over the lower legs. And other that I could advise is that patient could wear thromboembolic deterrent stockings or graduated compression stockings, either 3 or 4 layered. And then if the varicose veins are not improving with the conservative management, then there could be surgical intervention, like there could be a varicose vein, there could be a phlebectomy. We could do injection foam sclerotherapy.
Okay, good. Thank you.
Thank you, ma'am.
Right. Yes, it was good. You covered everything. When you were mentioning the findings, maybe you could tell that there were no ulcers, and they were because patient was having just the swelling and there were no ulcers. And what if there were any eczema, if there was any hemosiderin or any depositions you could see.
Venous ulcer, I forgot.
Those you can, in addition to what you've done, you can mention.
Yes, ma'am.
You've done the tourniquet test, you've done the Percy test, you've done the Doppler. Yes. I think you covered everything, so that's good.
Thank you, ma'am.
Yeah, good. Yeah, almost everything was covered. Good. Very good.
Thank you, ma'am.
And then it was random, so excellent.